Our last stop of the day is about communication and awareness raising. Communication connects everything and everyone. Explaining resistance in ways that engage family, farmers, pet owners, doctors, nurses, veterinarians, citizens, and policymakers. Awareness turns science into action. And because AMR is not just a microbiological challenge, it is social, cultural, and deeply human. We are raising awareness and communicate from evidence with an engaging perspective through our words, the context, the backgrounds, and the ideas. To end our EU-JAMRAI 2 journey, let's welcome the colleagues working on communication and awareness raising. And for that team, I don't have to explain where to stand, how to speak, because this is their job every day. So, thank you very much. And so I call first on stage Laura Alonso and Richard Vaux. Thank you.
Okay, thank you, Marie-Cécile. So, thank you so much for being here after lunch and being on time. Now it's time to talk about awareness raising. In EU-JAMRAI, you know that we take communication very seriously as a core part of our effort to contain AMR. We often think about science communication as just a way to explain complex information. But it is much more than that. Science communication is an opportunity to engage the public. It's about connecting evidence with real people and real concerns while trying to promote positive behavior.
So in the next hour, the communication team will briefly share the following: some results of our dissemination efforts, and also the studies, campaigns, and activities developed during the last year. And after that, we will have time for questions, hopefully. And finally, we will share the next steps.
So let's start with dissemination. And we know that you might be a little bit sleepy now after lunch, so we have decided to tell you a story. So let's imagine that our EU-JAMRAI 2 is an Erasmus student, traveler, curious, eager to know their European countries and neighbors, and of course a very fast learner. In this story, events are the social life of our Erasmus student. This is where she meets people, exchanges ideas, and realizes that her concerns, her challenges are shared across countries, but just in different languages and different contexts. Conferences, workshops, meetings. This is where EU-JAMRAI 2 becomes a conversation, like here in the annual meeting. And like every good Erasmus student, if they're good, and they have good grades, of course, there's a time to stop partying and speak about numbers, right, Richard?
Yes, indeed. Of course, through events, EU-JAMRAI has been actively present across Europe.
Next slide.
Oh, I'm sorry. In total, the project has participated in 58 events covering 18 countries. And these events allowed us to reach diverse professional audiences, strengthen networks, and increase the visibility of the project in different contexts.
And now let's speak about our website. In our Erasmus student story, it will be her portfolio. This is where she brings together the work that he has developed and also what she's capable of. The website is where the project is presented in a clear and structured way. It brings together resources, campaigns, news, updates, and results.
So some figures about the website, because it has shown steady and growing engagement. And indeed, during the last year, it recorded more than 82,000 page views and over 43 visits and close to 38,000 visitors, which is an achievement. These figures reflect the sustained interest in the project and in its activities.
And of course, social media. If we are young and if we are an Erasmus student, we have social media. This is where our student shares everyday life and stays connected with old and new friends. Social media is where EU-JAMRAI becomes more informal and more human. It's about listening to and keeping the conversation alive. And sometimes it is also the place where EU-JAMRAI partners pretend to behave like young people.
So once again, in 2025, EU-JAMRAI published a total of almost 200 posts across social media channels, and this generated more than 11 million impressions and an increase of over 428% compared to the previous period. And the project reached more than 7,000 followers across platforms and recorded over 38 interactions, which shows the strong and growing engagement.
I left you the hard part with the numbers, Richard. Sorry. Now the newsletter. In this story, this is where our student writes home from time to time. You know, they're busy partying, to explain how things are going. The newsletter allows us to step back a little bit and summarize the most important updates. It is shared with a close and interested community that follows us very closely.
So, the EU-JAMRAI has sent a total of 7 newsletters since the beginning, reaching close to 1,900 subscribers. And the average opening rate is over 32%, which is above the average for this type of institutional newsletter, and show consistent interest from our audience.
And then we have our Tuesdays Connect. This is where our students attend in-depth online classes, a regular space to stop, focus, and learn together with others.
So our Tuesday Connect is a monthly webinar series designed to bring together experts, policymakers, and stakeholders so as to discuss key topics related to antimicrobial resistance and share updates on the joint action. And so far, a total of 10 Tuesday Connect sessions have been organized, and the sessions have generated strong participation with more than 1,200 live connections. The topics covered reflect the diversity and depth of the work carried out within the EU-JAMRAI, from access to antibiotics and stewardships to surveillance, and of course the One Health approaches. And finally, we come to the Lancet, because for our Erasmus student, this is a very special moment. All her hard work is reflected in her first scientific publication. So EU-JAMRAI leaders have recently published a paper, Strengthening Antimicrobial Resistant Governance in Europe, a coordinated One Health approach. This in the Lancet Regional Health Europe, with a message that could not be more timely. The paper highlights that stronger accountability, political commitment, sustained funding and coordinated leadership are essential to turn strategies into action and protect citizens' health. It also underlines that strengthening AMR governance through a unified European approach is crucial to achieving lasting progress against AMR.
We have also submitted the illustration. Oh, sorry, one step back,
sorry.
please.
So
The illustration you can see on the screen to the cover competition. The image takes the AMR symbol as the central element, shown as a work in progress, under construction. It conveys collective effort, process, and shared responsibility. Conceptually, the idea is that the symbol does not exist by isolation, but it is built together. A direct metaphor of the One Health approach, right? Where every contribution and every collaboration matters. We hope the illustration will be selected and will continue to inspire the scientific community. And I think that now it's time that we give a break to our Erasmus student. Thank you very much for your attention. Okay, and now we move to the block communication results, studies, campaigns, and actions. And it is my pleasure to call to the stage to our colleague Jonathan Gómez-Raja from FundeSalud, who will present the AMR campaigns and messages study.
Thank you, Laura. Well, it's for me a pleasure to be here. I'm coming from FundeSalud Foundation, it's part of the government of Extremadura in Spain, and we have conducted a study to evaluate, the state of the campaigns, messages, or all the material we are using right now in Europe regarding AMR. So for that, we identify what awareness raising messages and materials are present now in Europe, all related to healthcare associated infections and hand washing, hand hygiene in Europe. On the 30 European countries we are part of the project in the last 15 years, more or less, and all available in the national languages and also in English. What for? To understand the communication approaches, channels, audiences, objectives, what we are doing right now in order to improve, to raise the awareness regarding this matter. In the end, to identify gaps in terms of accessibility, equity, diversity, and communication effectiveness. The type of material documents we have reviewed is, as you see in the presentation, all the institutional awareness material, leaflets, posters, infographics, videos, websites, and so on, and also the reports from your national plans. This is a template, so we used, as you can see, was a really, really huge work in order to collect all the information regarding basic information, target audiences, funding, strategy, evaluation, all these KPIs we were collecting in the 300 materials, 300 campaigns and material we identified so far right now. Here you can have some preliminary results based on these 300. Distribution by campaign, so mostly all the material, 80% is operates at national level, so reflecting the local engagement we have. Websites are the most frequent, and then social media. All the traditional media is still present in this. We have the format regarding digital and hybrid media, and also we have a gradual diversification of communication practices and some communication regarding this co-design and participatory approaches are emerging. The target audience, mostly public outreach with professional and institutional engagement. A general public and healthcare professional are the first one in the list, but fortunately we see a progressive integration of the One Health approach and the One Health concept into the awareness raising practices in Europe. Key findings you have here. So basically everything is based on the international campaigns where the European Antibiotics Awareness Day by this ECDC or the Antimicrobial Awareness Week by the WHO, but everything rely on voluntary basis in the different countries to implement and to adapt these international campaigns into the different local environments. So we have some gaps regarding equity, some vulnerable population is still underrepresented, And we need more tools for evaluation. So many campaigns and material are implemented but not evaluated. So we lack evidence on behavioral outcomes. And also, we need more innovative and participatory approaches. These are kind of recommendations we have so far based on this study. We need to promote sustained and evidence-based communication strategy. For sure, we need more evaluation about what we are doing to see if it is working or not. We, for sure, have to work on equity and accessibility, to collaborate and exchange, acknowledge regarding member states, and also to integrate the co-design, I said before, co-creation approaches involving patients, professionals, and communities. And this study is a really, really nice study to find the best practices that we can implement in other countries. Everything is now, I mean, it's not available yet. It will be available Monday or next week in a website where you can find all these database, when you can play it, when you can find, you can filter per country, per target audience, per material, etc., etc. And now is the time for you to go to there. You will receive some email from us on all the countries to go there, validate what we found so far, and also integrate your materials and campaigns that are not available because probably we didn't find it in this first study. So the idea is now is your turn to contribute and to share all this information. Thank you very much.
Thank you, Jonathan. Now let's call to the stage to our wonderful Anna and Víctor communication colleagues. So creative and so great team to work with. Come.
Thank you, Laura. It's a pleasure to be part of this communication team. So, hi, let's now turn to the crown jewel of the communication work of 2025, which is the Sketching Antimicrobial Resistance campaign. This unique initiative brought together 30 illustrators from 30 countries with a shared goal to make antimicrobial resistance visible, understandable, and emotionally engaging. As many of you already know, the campaign unfolds across 3 complementary pillars: a strong social media presence supported by a dedicated website, an illustrated, beautiful album, and public exhibitions hosted in 5 countries. Video, please. I love this video.
Well, as you may already know, we are proud to say that yesterday, coinciding with this annual meeting, EU-JAMRAI inaugurated the first Sketching AMR exhibition. It is located at the University of Vienna. It's composed with the 32 panels, with all the illustrations printed in large format, together with an introduction, a conclusion to offer some context to the initiative. And the contents that complement the illustrations are both in German and English. However, an audio guide is also available, and you can play it on your mobile phone with narration in English, German, Italian, Dutch, French, Polish, and Spanish. The aim is to make this content more accessible and immersive. And in February, we will open the Sketching AMR exhibition in Warsaw, in March in Brussels, in April in Rome, in May in Madrid, and besides, some partners have shown interest in organizing the exhibition in their countries. So if this were your case, please don't hesitate to contact us and we can talk.
The illustrated book is an invitation to look closer, to discover the beauty of a balanced microbial world, and to recognize the power we hold to preserve it. Each illustration and each message contributes is a fragment of a shared story, a story that belongs to all of us. Because caring for our antibiotics ultimately means caring for life itself. 50,000 copies of the book have been produced and will be distributed across all 30 countries participating in EU-JAMRAI too. With the support, we want to thank to our communication network and our communication partner. And we are especially pleased to have brought copies here that you can take home and you can experience the book firsthand.
The illustrators selected to participate in this campaign, the social media campaign, has reached more than 12 million people across Europe and has achieved 38,000 interactions, including likes, shares, comments, etc. One illustration per day was published during November and December, starting in the framework of the European Antibiotic Awareness Day and the World Antimicrobial Awareness Week. And we shared them on our social media channels, Facebook, X, LinkedIn. But Instagram was the main channel for this campaign because it gathered the highest number of followers of the artist profiles, and we could make collaborative publications easily. Regarding the qualitative analysis, the general feedback we have received was quite positive. We have also followed and listened to all the comments, and we were very happy to read things, for example, like this. We will translate. This says, "Thank you too much. This is extremely important during this week when hospitals and ICUs are full capacity." People trust our campaign, and they shared their own personal stories. For example, this other one that says, "I love it, and yes, something as simple as washing your hands can really save lives. When my children were little, I was able to go to their class and talk to them about microorganisms. At the end of the talk, I had them wash their hands and put them on a plate. Just by leaving them at room temperature, the microorganisms grew, and even with freshly washed hands." So we were very happy to receive that kind of feedback. The campaign also presented a multilingual component. For example, on Instagram, each illustrator shared their artwork with the comment both in English and their native language. And we also created a specific web page for Sketching AMR, gathering all the illustrations and messages in 24 languages. And that page has had already 10,000 visits so far. And in the landing page, the illustrating album is also available to download in PDF format.
And all of this was built on a solid foundation. Scientific rigor and the genuine commitment from the illustrators. Before they put pencil to paper, We invited them to a webinar where antimicrobial resistance was explained in depth. Many later shared that the session was truly eye-opening, as several of them initially held misconceptions or had only very limited understanding of the topic. A strong foundation does not guarantee success, but it makes meaningful, responsible communication.
Well, the final result is very beautiful and we are very proud, but we also have to say that the process has not been a piece of cake. It has been a collaborative effort with different dimensions and many actors actively involved. And here you can see just an example of the dozens of documents we had to work on only for the translations into 24 languages. And we would like to take this opportunity to thank the AMR Communicators Network and our partners involved in Work Package 10, without whom sketching AMR would not be possible.
One of the most significant milestones for communication in 2025 was the European AMR Communicators Network workshop that we held in September in Brussels. The workshop was co-organized by FPS, Health, Food Chain Safety and Environment, and the Spanish Agency of Medicines and Medical Devices, with the support of the European Commission. This network was created with a clear purpose: to co-design and co-implement awareness-raising actions on antimicrobial resistance across all countries participating in the joint actions. Today, the AMR Communicators Network brings together 42 experts from the 30 countries of the EU-JAMRAI 2, forming a truly collaborative European community of practice. And beyond learning from each another, the network is built on a simple philosophy. We grow stronger when we also learn from voices outside our immediate field. That is why we were honored to welcome Dr. Eva Krokow from the University of Leicester, who joined us in Brussels to present her research on antimicrobial resistant metaphors, a study in which the EU-JAMRAI 2 communication team has actively participated. One of the key conclusions was stricken. While war and combat metaphors are often easily recognized and understood by the general public, most participants rejected belligerent language. They describe it as aggressive, overused, and ultimately misleading because it oversimplifies the complex nature of bacteria by portraying them solely as hostile enemies. This insight reinforces a core principle of our communication work. The words we choose matter, not only for clarity, but for trust, understanding, and long-term engagement.
During this workshop, we also reviewed and co-created many of the key messages for the Sketching AMR campaign to ensure they were appropriate and understandable in various European contexts. Besides this, our colleague shared the progress from the communication and education studies taking place in the framework of Work Package 10, like Jonathan has done a minute ago. And we brainstormed innovative actions that we are planning to keep on engaging the public with AMR. And we also exchange experiences and practices from different partners across Europe. So in conclusion, they were 2 inspiring days of collaboration, exchange, and creativity.
Working side by side with a stakeholder is essential to build shared understanding, foster trust, and co-create solutions that deliver real and lasting impact. In 2025, EU-JAMRAI 2 strengthened this approach through close collaboration with the World Organization for Animal Health and the World Small Animal Veterinary Association. Together, we developed targeted communication materials for pet owners designed to help them understand why antimicrobial resistance matters, what they can do to contain it, and how responsible use of antibiotics protects both their pets and themselves. These materials were produced in English, Spanish, and Portuguese, reflecting their primary audience, veterinarians attending the WASAVA World Congress 2025 held in Rio, Brazil. What began as a focused collaboration quickly proved its value. As a result, we plan to work together again to develop new materials for the WASAVA World Congress 2026, who is going to happen in October in Warsaw, in Poland. Alongside these materials, AMR pins were distributed both at the WASAVA Congress in Rio and at the WOA General Session in Paris, helping to spark conversations and increase visibility around AMR in key professionals' settings. In parallel, we also co-created a second set of materials with WOA, focused on raising awareness of the impact of antimicrobial resistance along the food supply chain and highlighting the essence role of veterinary services in safeguarding animal and public health. Video, please.
But AMR doesn't only threaten human health, it also threatens our food supply chain. When livestock suffer from drug-resistant infections, production drops, food prices can rise, and shortages can become more frequent. By 2050, AMR could cause losses equivalent to the food needs of 2 billion people every year. That's approximately 1 in 5 of the world's projected population. Yet there's hope. Through universal access to safe water and sanitation, stronger healthcare, and improved vaccination, we could save 110 million lives. And cutting antimicrobial use in animals by 30% could boost the global economy by $120 billion in just 5 years. So, what can veterinary services do?
This is only 20-30 seconds, but you can find the video on our website. And with this video, we took one step further, launching the One Health World animated video series, a new communication space where animal, human, and environment health come together through accessible storytelling.
Could easily infect our pets, severely compromising their health. And
Well, since we had a really cool animated video, why not think about a series covering various aspects of antimicrobial resistance? And so it was born One Health World animated video series. We think these videos can be a useful resource for raising awareness on social media, but also an interesting material to support talks, presentation, educational activities, or any other raising awareness actions or events. At the moment, we have developed one about the impact of AMR in the food supply chain, which we have already seen. Another one targeted to pet owners and veterinarians, and the most recent one regarding the importance of hand washing for infection prevention. And let us show some highlights to you. Video, please.
bugs resistant to antibiotics could easily infect our pets, severely compromising their health. And they can be transmitted between pets and their owners, in both directions. But we can prevent this from happening. Healthy pets don't need antibiotics. Taking your pets for routine health checkups is a critical step in preventing infections before they start.
Thank you. And we can see also the other one about infection prevention. The other video, please.
Today we know hand washing prevents infections. 20 seconds, soap, friction, such a simple act. And yet, one that can decide between health and disease. But 200 years ago, that idea sounded crazy. Hospitals were filthy. No adequate ventilation, no gloves, no soap. Women giving birth often died from infections caught inside those very hospitals. Then came Ignaz Semmelweis, a doctor in Vienna.
I don't know if comment on the woman or about Semmelweis, which was working in Vienna. Okay, so as you have seen in the videos, sometimes talking about science is telling stories. And when those stories are shared in front of live audience, something special happened. We have the opportunity to evoke emotions, to listen to questions, and to create a genuine dialogue with the public. Communication becomes a two-way exchange. Throughout the projects, EU-JAMRAI 2 has taken part in a wide range of initiatives with a single goal: to bring science closer to people's everyday life. We have talked about antimicrobial resistance at the European Researchers' Night, in nursing homes, in schools, and on a stage in front of more than 2,000 people, among many other settings. And we truly value this way of raising awareness, because the science is shared openly, accessibly, and face-to-face, and it becomes more human, more memorable, and more impactful.
And well, you all know our symbol. It was created during the first edition of EU-JAMRAI, but it is during this second edition that is really spreading and becoming known. We have distributed more than 12,500 pins, which have traveled to congresses and events, even beyond the borders of Europe. It has also been featured on the cover of the Swedish government's new antimicrobial resistance strategy, or recognized in the Third National Action Plan of Ireland. And we have used the revision of the EU pharmaceutical legislation as an opportunity to promote the inclusion of the AMR symbol in antimicrobials. Over the past month, this initiative has gone through several steps: the preparation and dissemination of a position paper, its inclusion in Spain's official comments on the legislative revision, outreach through the EU-JAMRAI 2 liaison officers to national health attachés, and close coordination between the COM team, our estimated Antonio from AEMPS, and the health attachés to support the proposals. Initially, we advocated for inclusion of the AMR symbol on the outer packaging. However, following opposition from 2 member states, we focused on the most realistic approach at this stage. And in the final trilogue agreement reached in December, 2 key points were secured: the inclusion of the AMR symbol in the package leaflet, and the inclusion of an awareness card of the proper handling on the proper handling and disposal of antimicrobials when the leaflet is digital only. So we now hope to see this implemented in practice, as it could become a powerful tool to raise awareness at the very moment when patients are making decisions about using antimicrobials. We received a proposal to use the AMR symbol in the promotional campaign for a BBC documentary on antimicrobial resistance. The name of the film is Love Our Antibiotics, and it is scheduled to premiere in the summer of 2026. And another wonderful proposal came from the Nobel Prize Museum, which is going to sell the pin in its souvenir shop at a symbolic price, and the benefits would be used to organize events to raise awareness about antimicrobial resistance. We are still in the process of finalizing this, but we would like to thank our Swedish colleague, Annette, for your involvement in making this proposal a success. And well, we are building all together a One Health world to reduce antimicrobial resistance, and we are convinced that communication and raising awareness play an important role on it. Thank you.
Okay, now it will be time for a Q&A. So if Jonathan can join us and Richard in the stage, please. Like this, we're fine. In the middle. Okay, in the middle. In the middle. Yeah, a very small precision about the documentary from BBC and HBO. The title actually is Superbug, but the slogan that the public relations and communication agency in charge of promoting this documentary would be Love Our Antibiotics. So just wanted to clarify that. So we are ready for your questions.
Good afternoon. My name is Ivana Retsevich. I work for the European Commission. I have a very simple question. Is it possible, hopefully I haven't missed that on the website, to download the pictures, to print it in high resolution, to decorate our offices, corridors, etc.? Thank you.
Yes, you can. You will find in the website a page explaining how to do it and how to give the proper credits to the illustrators. And this page already includes a proposal for the text, the correct names of the illustrators. So we just, really make the call to use it, but the proper way. Because, there's been a contract signed with them and we must respect it, so they should always be used in the context of the campaign.
And if you need the images with more resolution, of course, contact us and we will send you.
I think there's one there.
Hello, my name's Sarah Earnshaw. I'm from the ECDC, and I just wanted to really say, wow. This work is so beautiful, and it really goes such a long way to capture hearts as well as minds, which I think in this area of communication on AMR in particular and communicable diseases is often missing. So just a huge, huge thank you for all the creativity and the incredible work that you've done. And it's very inspiring. I'll also be printing out some of those sketches to have on my wall. Thank you.
Thank you so much, Sarah, for your kind words.
My favorite question, languages, translations. How is it with the, okay, I love the idea of decorating our offices, which is really cool, but we're thinking of hitting the schools and kindergartens and whatever primary prevention activities. So is it also possible to redub the videos under any intellectual property conditions? How do we go about this?
You mean the videos that we've shown
Yes.
from WOA? Yes, absolutely. Drop us an email and we can discuss it with subtitles. It's always a question of organizing it.
Wonderful, thank you.
Hi, congratulations on all of this. It's indeed amazing. Are you already working on, or do you have plans to let the rest of the world benefit from this? Because of course the burden of AMR is beyond Europe and it's even bigger. Yeah, I'd like to hear your vision on this.
Well, yes, of course. I'll be very honest. The problem is internal capacity, right, to follow everything. As you have seen, coordinating the translation so early for the participating countries in EU-JAMRAI 2 has been a tremendous effort. Thousands of emails and exchanges and a lot of organization. But yes, it is possible, and I think that we are always open, absolutely, and it's a question of looking at it case by case and see how much the other part can do, right? Because we can give all the editable versions, and if they keep the burden of coordinating the translations, we could do it. But right now, we also have to concentrate on putting to practice the next steps, the other campaigns and activities that we are going to present you after this Q&A. But if you have ever someone interested in it, feel free to give them our contact and we will of course look at it.
Thank you so much for all of your enthusiasm, dedication. I mean, everything. It's just like she said, Sarah said from ECDC. Wow, very, very appreciative all your hard work. And I love that the symbol will go on electronic leaflets in antibiotics. I just want to say that be careful about putting them on the actual paper leaflets because I think those are black and white, and we don't want to make antibiotics more expensive.
Yes, you're right. We are aware of that, and we'll see how everything. Now we have, this approved, and but then we will see the next steps. I don't know if Antonio wants to add anything. We have Antonio here. He has really coordinated all this effort with the council.
You are completely right, Cristina. We are aware of that. We have some claims from the pharmaceutical industry about this going to increase the price and the cost of leaflet. That's why we are trying to go through the electronic information. So yes, thank you for the comment. And also I want to take the opportunity to thank the liaisons because we had a lot of help from a lot of member states pushing through EU-JAMRAI to get this to be included in the leaflet. Apart from that, we will see if it is finally approved because now it's the part of the negotiations, the trilogues, and let's see. But it's a great step. Congratulations.
And also a special word to our coordination team, who's always open to all our ideas, all our proposals, and always willing to support, to send the emails that we need, to contact the liaisons. Thank you so much, from our heart. I think there's a question here.
It's not a question. Elisabeth Erlacher-Windel from the World Organization for Animal Health. I just want to answer to the globalization. I think that is an organization that is global. So at least for this part, and thank you very much, not only for the collaboration, but also for the way you present this. It's really inspiring. But just to answer, there is already one channel, at least for the one that we do in collaboration. Thank you very much.
Thank you.
Hello, hello. Yes. So thank you very much. Very, very interesting and very cool. I have something completely different. Because what I think is really great here is that so many young people are organizing this and gives a presentation, which I think it's really wonderful. I have one question, because here are some older people in the audience, like me, and the slides are sometimes very big on this, and then I love it, I can read them. And then they are small and the person is besides this, and this is really a problem, and for others I have heard it as well. Perhaps we can do them all this big. I don't know if it is because of the presentation in the net, but you probably know what I mean. They are becoming big and then there's no person. This is much better, and I ask you to do it all the time, because otherwise it's complicated to see, or I'm not able to read it, most of them.
Okay, thank you. Well, you made my day calling me young. Really, they are young, I'm not.
Not so young.
Yes?
Try again?
Yes. Perfect. So it's not a question, it's really a huge congratulations, because it's not so normal that projects get their results translated into regulation and into policy. And even if it looks like a small thing, it's really a big effort. And I do work with policy as public affairs manager, and I know how much work it gives to put a small amendment, even one word in the text. So really huge congratulations for making this possible and for giving the importance that it deserves to connect the science and the policy.
Thank you. I think that we can also share, the story that one of the most rewarding things about working in communication is that everything starts with an idea, and then you can touch the book. And everything starts with Jean-Baptiste, many years ago, saying, we should do something like the AIDS Red Ribbon for AMR. So I think that it takes a lot of people that are a bit romantic and idealist and want to make things happen, but then put all the effort we need, right?
And also, how important is the sustainability of the projects? Because in EU-JAMRAI 1, we created the symbol. But in EU-JAMRAI 2, we are spreading the symbol around Europe. If EU-JAMRAI 2 wasn't alive, maybe the symbol was dead.
Yeah. Totally. It also took the implication of partners from EU-JAMRAI 1 that kept it alive once we were in between the joint actions, right? And so, yeah, definitely.
Thank you. Thank you for your work. Thank you for your work and for the way you have presented today. And I think this is one of the very good things of the annual meeting, is that we can have an integrative approach. And now, seeing what 6.3 did with the training and education, which is a guidance on how to do it, I see the value of doing something similar with a systematic review that you did of all the campaigns, and some guidance on, if you want to campaign, what are you targeting? And having that tool that help us out of JAMRAI 2 to build campaigns based on all the expertise, all the knowledge that you have created. I think for me it would be very, very, very helpful. And I encourage you to try, because your job, I mean, this is very, very valuable. And thank you again for your hard work.
Thank you, Jonathan. I don't know if you want to complement, because now we need the countries, right?
Right, that's, can you hear me? Yeah, that's exactly what we want, that this repository, this database will be a tool to find first best practices that works, and also to find the gaps, and to, in order to develop the campaigns and your messages covering those gaps. So trying to improve the way we are communicating this topic. And now, as Laura said, it's your turn to go there, to play, to filter, to find, to get your results based on the different key messages you want to communicate and so on. But also to validate the information we have, because this information is based on the study conducted online. So now it's your turn to validate in your countries that this is exactly the campaigns we found, and also, most importantly, new campaigns and new material, new documents you have in your country that is not represented in this database, in order to make it so it will be something live, something that we will survive, hopefully, after JAMRAI 2, and it will be a tool for improving the way we are communicating AMR and so on.
I think we have time for, okay, sorry, the last question as we...
Okay, you haven't mentioned microcombat, because I understand it's from the previous edition, but I was wondering if you have any kind of numbers or ideas about the intake among young people, and also for this gremium here, we all might have children that we might want to promote this game to them, and it's probably one of the very few games that should be promoted to children. Thank you.
Yeah, we have plans to promote microcombat, and actually we are looking at collaborating with the European School Network, which is SchoolNet, which is a network of all the education ministries in Europe that have scientific programs, and they will help us promote microcombat and other tools for children and really get the feedback from it. And also, our colleagues from Belgium are going to develop a study to analyze the facilitators and barriers to raising awareness in schools, and they will look at things like microcombat or other things that have been developed for kids. Now, next steps. So now very briefly, we will go to the next step sessions, just 5 minutes to share with you our next steps. So we have already taken important steps to develop EU-JAMRAI's 2 escape room. Some of you might already have heard about it. An interactive learning experience that will allow participants to engage with AMR through action, not just information. The approach is playful, immersive, and collaborative. It combines problem solving and challenges to promote active learning. Participants should be able to develop skills such as critical thinking, communication, and teamwork, while engaging with AMR concepts in a very practical way. We have started developing it with experienced partners. Parque de las Ciencias, a big and innovative science museum in Granada. Ceo Aberto, experienced escape room designers. And Excite, the European Association of Science Centers and Museums, that will help us scale up this project to 5 museums across Europe. In parallel, a multilingual online version will allow us to reach wider audiences. The main target groups are high school students, aged 12 to 16, and the general public. This allows us to combine early awareness with broader social outreach. We are currently working on the game dynamics. What we can already share is that the design we are developing is modular and adaptable. The 2 core concepts and ideas behind it is replicating a laboratory and a village with its healthcare center, the pharmacy, the veterinary clinic, and the farm, always with the One Health concept behind. We are also planning to explore new formats. One of the ideas that we are working on, it's a fictional podcast about AMR. The aim will be to reach the general public in a different way through storytelling, as Anna was explaining. We believe that audio fiction could allow us to talk about AMR through stories that feel familiar and close to everyday life. By using characters and situations that reflect real life, the podcast could help us, help people recognize how AMR is related to the choice they make, to their everyday life. The plan would be to develop a series of 6 episodes, available in all the project languages again, translations. We also hope to involve well-known actors from across Europe, organize a premiere in Brussels, and support the launch with paid promotions. Since ancient times, performing arts have been used to raise awareness by connecting with emotions, imagination, and the sense of childhood that we all hold and carry inside. The European Union recognizes the social and educational potential of the circus, and we would like to explore how this format could help us spark interest and reflection around antimicrobial resistance. Circus is art without language barriers. Few words are needed, less translations. It's about body language, dance, acrobatics, music, lighting, and set design. The plan is organizing performances in 6 European cities, designed for a broad audience across different social and economic backgrounds. And, well, I wanted to leave this slide for the end and not showing, but this will be to answer a question that my colleague Anna asked to all the participants in the Communicators Network workshop in Brussels. She asked after presenting this, are we crazy? So do you think we are crazy, or do you agree with Ivan, who referred to this phrase to reply to Anna? Madness is doing the same things and expecting different results. So wish us luck, because we are not sure of everything. We are doing a very difficult thing, with long-term results. We cannot do magic to change things in very little time. And that's all. And then now it's when I'm really going to finish. I don't know why. Well, the next slide was to invite you to come to see the exhibition with us after the side events. You have printed instructions on the front desk, and we will also share all the directions with you through the Telegram group. Thank you so much.